if it's like a mild injury or more of a soft tissue thing. I'm not sure.
How's it feeling after the adjustment?
It's feeling a little better, but
Yeah.
I feel like it could be worked on, maybe.
Definitely, yeah, definitely. All right. Just keep me updated about the pressure.
Yeah.
You know, if anything bothers you, just...
I kind of like it, like even though it's like a pain that feels good. That makes
Yeah, a
sense.
good hurt.
Yeah, good hurt, yeah.
All right, let's do it. So I kind of feel the tension like right on the rhomboids.
Mm-hmm.
Right in there. Is that okay?
Oh, yeah.
Right there, too.
Yeah.
There's like one muscle that kind of just leads right up to that neck.
Yeah,
They're all
yeah.
connected to that shoulder. All right, Ray, I think we did a good job today.
Yeah.